biggest risk for fractures is whether somebody falls or not. And 95% of fractures occur because somebody falls. So it's not only, but what's happening with the whole person. The food choices we make every day impact our skeleton, impact our fracture risk, and is actually determining what our future health is going to be.
Over time, the symptoms went away because what we did, we reversed the gut flora. And the gut flora is, we have so many bacteria in our gut, 10 times more than our cells in the body.
Bone health is really a marker of health span, and it's a marker of longevity.
You have taken your calcium, you are done with your DEXA scans, and your doctor says your bones are fine. Think again. This conversation is something more than that your doctor had left out. We are not losing war on bone densities because we are having lack of treatment. We are losing the war because we are measuring the wrong variable altogether. We are not at all looking at the things, what is depleting our skeleton long before they are shown in the scans. I am Swati Kaul, joined by Dr. Virender Sodhi at the Disease Free Society podcast with Dr. John Neustadt. He is the founder and director of nutritional biochemistry. He is the world-renowned author of the book Fracture Proof Your Bones and has been recognized as the top 10 most cited author by the journal Alzheimer's. He has spent over 2 decades of his career researching about just one question: not how we increase our bone density, but what is that trigger that is leading to the depletion of our bones. Dr. Neustadt, I'll directly come to you. You had been researching about the bones and the bone density for quite a long. What is in your clinical experience you start with the patients? You see the profile of the patient that you say that this person is going to have this bone disease and he's going to be diagnosed with something.
Well, thank you for having me on the podcast for what's going to be, I know, a phenomenal discussion. This is something that I've been passionate about for decades. And the moment I meet somebody, I start to evaluate them like a good clinician would. The evaluation, what we see, what we hear, the strength of somebody's grip, all of those can determine or count towards somebody's risk for bone loss. So grip strength alone, how strong somebody shakes a hand or grips a top of a jar to screw on or off the top, that is associated with bone density. And as people get older and their grip strength starts going down, the parallel phenomenon that we see is that bone density is also linked to decreasing grip strength as well. And how well somebody can walk, whether they are shuffling, whether they are walking at a normal fast pace or their pace is slowing down and they're less steady on their feet. All of those are clues to what's going on inside the body. And if we're talking about identifying risk factors, decades before this disease actually occurs, before somebody starts losing bone, there are a lot of risk factors that can be recognized, but unfortunately are not conventionally recognized or discussed. And one of those is the crucial role that diet plays. Eating, ultra processed foods, the standard American diet, is associated with increased osteoporosis risk. And that's very clear that the opposite, a healthy diet, will reduce that risk. Whether someone is exercising, if they have a sedentary life, are they a smoker? What is their family history? All of these things and more are clues. And one of the most important things that I see that is not being discussed is what medications they're taking, because there's a long list of drugs that are destroying bone, increasing fall risk and increasing fracture risk. And in fact, the biggest risk for fractures is whether somebody falls or not. And 95% of fractures occur because somebody falls. So it's not only thinking about, for me, what is going on with bone metabolism and bone physiology and the architecture in bone, but what's happening with the whole person. And what is their risk for the ultimately what is the most dangerous thing, and that's breaking a bone.
I am glad you brought these tiny symptoms that we should be looking for. I think our Disease Free Society podcast, it is all about identifying those daily symptoms that we all go through before the disease is actually diagnosed in us. So really thank you for bringing that out. Dr. Sodhi, from an Ayurvedic perspective, what would be your take on the bone density and how would you relate to what Dr. John Neustadt said?
So, the Ayurvedic concept is very clear, it's simple. It starts with many factors, but as the Dr. Neustadt said, the garbage diet, the sad diet, the standard American diet we eat. Uh, if you are eating garbage in, garbage out, there is no way out. Our food lacks the minerals. We are not eating enough vegetables. We're not eating enough protein. Like, I see a lot of Indian population as my patient, and majority of them are vegetarian, which is nothing wrong. But the problem with them is they're not eating enough amount of protein. They have roti, bread, rice, pasta kind of stuff, and vegetables very small. Protein content is very small. They're eating dal, and nuts they're eating 5 almonds. So there is not enough building blocks, the scaffolding of the bone structure.
Dr. John, you mentioned about the medications. I think they are the most important or the most underrated factors in the bone study or what they said. What are my question would be, do the medications that patients already take destroy their tissues actually?
Yes, and I think that Dr. Sodhi put his opening remarks, incredibly eloquently, and I also just wanted to, and essentially bone loss and osteoporosis is a condition of imbalance. One of the most under-recognized destroyers of bones are medications. The most commonly prescribed medications are destroying people's bones and increasing fracture risk. And unfortunately, most clinicians who are prescribing those medications are unaware of that. There have been studies that have looked at this. And so, for example, antidepressants. And the commonly prescribed category of antidepressants are those that increase serotonin, SSRIs and SNRI medications, Lexapro, Prozac, and others. Well, there are serotonin receptors on bone. And when we artificially increase serotonin with these medications, it's activating those receptors, and those in turn stimulate bone destroying osteoclast cells to break down more bone and to break it down faster. So the bone building osteoblast cells can't keep up, and that delicate balance is disrupted. In fact, we know now for women taking an SSRI for 1 to 5 years, for every 19 of those women, we now expect one of them will fracture. Acid blocking medications, proton pump inhibitors, those are commonly prescribed for acid reflux. In fact, 50% of them are prescribed for acid reflux, which is in many cases easy to treat and reverse, so they don't need it with diet and lifestyle changes, or recognizing if there's an underlying dysbiosis, imbalance, or infection that can all be helped naturally and with integrative approaches to restore that balance. So maybe they don't need the medication. But if they're on a proton pump inhibitor, it increases the risk for the fact the most dangerous type of fracture, which is hip fractures. And we now know that if a woman with osteoporosis breaks her hip, there's up to a 36% chance that she's going to be dead within a year. And men also are at increased risk for dying if they were to have a fracture. So looking at those medications, glucocorticoids like prednisone, powerful anti-inflammatories,
And they are
it's
all
very
like commonly prescribed over the counter medications. We are hardly educated or rather told about these anti effects or the side effects of these things. We are hardly aware of anything of this sort. So, how would you want to educate our viewers?
be able to get off of them altogether. I've had many cases where I've been able to discontinue medications from patients because we were looking, just like Dr. Sodhi does with his Ayurvedic approach, as naturopathic doctors, we're also looking at the underlying causes and we're trying to correct them. So when it comes to the medications, that is my approach. When it comes to diet, Dr. Sodhi and I are in complete agreement. Getting enough protein is really important, as well as eating lots of vegetables and getting all that natural healthy fiber and vitamins and minerals and other plant antioxidants that we know are crucial. There is a strong gut bone connection now that has been identified. And in the concept of fire in Ayurvedic, I interpret that in my mind that if there is too much fire, then that to me means inflammation. And that could mean dysbiosis. And please, Dr. Sodhi, correct me if I'm taking that concept out of context and not representing that correctly. But when I hear fire, I think inflammation, chronic inflammation is now in the gut is linked to osteoporosis and fractures, and they're both direct and indirect reasons for that. So there is a gut bone connection. What we eat, the food choices we make every day impact our skeleton, impact our fracture risk, and is actually determining what our future health is going to be. Dr. Tiana Lodog, who I also really like her work, I heard her speak not that long ago, and she said food can be your fastest form of poison or your slowest form of medicine. And I think that really is an accurate depiction.
Yes, I thank you, Dr. Neustadt. One interesting thing about what I see is the patients on PPIs, proton pump inhibitors like Prilosec, imidazole, all those kind of class of those drugs for 20 years, for 10 years, and without realizing that this medication is doing a damage to it. And as you said very nicely, that the problem is, so basically what happens, your gut is inflamed with many reasons. It can be you have a sensitivity, you have bacteria, a fungus or virus, or you are eating wrong food, which is if you eat deep fried food, barbecued food, they're all inflammatory. And this should not be eaten on a daily basis, but very rarely we should be eating them. Now what we putting down the fire by putting PPIs, because they stop the production of acid, which we very well need to actually digest the food properly. So the initial concept of this is entirely wrong. So I think we need to come to the basics, rather than slapping pills on top of the pills.
We need to reset our body in sync with the circadian rhythm, what it's supposed to be. That is what leads to the healthy lifestyle and good bone structure. Dr. Sodhi, you were mentioning about the calcium. All through our lives, we have heard that calcium is the building block of the bones. Eat paneer, cottage cheese, or drink milk. That would just strengthen the bones. Dr. Neustadt, I'll start from you. Is it even the truth? Do we really, do the bones really grow on the calcium?
Well, we need calcium for bone health as well as other minerals. Most of the minerals in bone that gives bone its hardness and its structure is calcium, but there are other minerals as well. There is no indication that you have to eat dairy to get enough calcium. There's lots of calcium in non-dairy products, vegetables, for example. Nuts and seeds have some calcium in it as well. If you eat fish, sardines are a great source of calcium. But in terms of calcium and bone health, I like to see it in two different ways. There's the concept of building bone quantity, and that's the amount of minerals in the bone. And that's what a bone density test measures, the quantity of the bone. But that doesn't translate necessarily into bone strength. In fact, a bone density test only predicts 44% of women who will break a bone with osteoporosis and only 21% of men. And a bone density test only measures the mineral component of the bone. It's a tissue, and all tissues are complex and they have other types of components. And the other major component that gives bone its bone strength is the protein in bones. There are 180 to 200 proteins in bone, in addition to collagen, which is the main structural protein in bone. That is what the minerals actually bind to. But healthy collagen is stronger than steel. And healthy collagen is flexible, meaning that if you fall, your body can absorb that impact and the bones can bend a little bit and not be fragile and not break. And that's why children, when they fall and they fall a lot, they're not breaking their bones because they've got lots of healthy collagen. And as we get older, that can become more brittle. It can also decrease in the amount of collagen as well as the bone density decreasing. And so it's more than just looking for me at calcium. It's understanding and asking the question, what combination of nutrients, both diet and or dietary supplements, have been shown to or linked to lower risk of osteoporosis, but more importantly, lower fracture risk, because that's the most dangerous thing. And I do counsel people that when they ask me, should I just take this one nutrient? Should I eat this single food? It's the overall pattern that's really the most important, not any one single activity or nutrient that's being put into the body, because ideally people are getting enough calcium from their food. And when you're getting calcium from your food, you're also getting many other minerals and vitamins and other plant nutrients that the body needs. So I just really encourage people to think beyond just calcium to more of a holistic approach.
Yeah, I think you brought this very well, the concept of the wholeness into it, because this is the bone structure does not the it's not only calcium, it's also minerals. It is also hormonal. It's also collagen. So there's just to put a one factor there. I think this is a very suitable subject for the our colleagues in allopathic medicine. You find one target and you're trying to find the one pill for it, and that model has completely failed. Bodies are complex, bodies are wholesome. We need a wholesome thing. Just the again, the calcium and the milk is a marketing.
Propaganda, a
Well,
PR is done regarding certain things, and then everybody just follow it blindly. Dr.
That's right.
Neustadt, you were mentioning about the hip fracture. How is it important? And rather, I would ask, why is it important that we need to look into that?
hip fractures are the most dangerous type of fractures. So if somebody, as I mentioned, with osteoporosis, a woman with osteoporosis fractures her hip, there's up to a 36% chance that she's going to be dead within a year. And the studies range from lower than that. Most often it's 20% that's cited, but 36% goes all the way up to 36%. Similarly, with a man, his risk for mortality or dying after a hip fracture is up to about 34%. And those people who fracture a hip and survive, over half of them never fully recover. They never regain their pre-fracture, pain-free life and level of mobility that they enjoyed before. And many of them continue to need care just with the most basic activities like brushing their teeth or going to the bathroom or bathing themselves. They need continuing and ongoing care. And chronic pain in the elderly is often due to osteoporotic fractures. So bone health is really a marker of health span, and it's a marker of longevity and definitely of quality of life, so we can enjoy our grandchildren and all the things that we love into our old age.
Okay.
Yeah, I can attest to that because after practicing for 46 years, and if somebody has a hip fracture, it's a bad news. The people hardly ever come out of it. Most of them die within 1 year. I've seen that too.
Okay, my last question to both of you. I would just want to take one non-negotiables from both of you for our viewers who are listening it. We'll start with you, Dr. Neustadt. What is that one key takeaway that the listener should take from this conversation?
That when they get the bone density test result, and it can be scary, and I understand that I've had many patients bring those test results to me. They've been told by their physician how dangerous it is, that they must start taking the medication immediately or they're going to fracture. I've had one patient even said their doctor told them they were going to die. And my most important takeaway is I tell people to take a breath, take a deep breath. Let's calm down. I put the bone density test result in its proper perspective, like I already did, how predictive or how limiting it is and how well it predicts fractures. But then I tell them, yes, this is important. Absolutely. But it's not an emergency. There's time to educate yourself, to learn what you can do and create a holistic bone health program that makes sense for you. That may include osteoporosis medications, but it may not. You have time to educate yourself, which is why I wrote my book, Fracture Proof Your Bones, to walk people through questions to ask their doctor so they're getting the best information and how to create this holistic bone health program to improve their bone density, stabilize their bone density, but most importantly, to maintain bone strength.
But I think one non-negotiable thing for me is exercise, weight bearing exercise, walking. Because if you don't walk, you're not going to push your calcium into the bones. You're not going to put your minerals into bone. If you don't weight train, they're not going to heavier. Heavier bone are fracture proof. This is a hands down statement. So I think all those things, again, Dr. Neustadt also talked about balance, and Ayurvedic medicine is science of balance. Without balance, balance is the key.
I would like to thank you both for coming here for Disease Free Society podcast and sharing such a vast information with our viewers. Viewers, if this changed a little bit, even if a one perspective for you, share this podcast with someone who is given the calcium and just said that, don't worry, you are fine. Share this with your parents who really need to listen to this. Thank you, doctors, and have a good day.